Hey everyone, I'm so excited to bring a company to the show today that's bringing the power of AI, data, and communities to patient engagement and healthcare in general. Eliran, how are you?
Hi, thank you very much. Nice
Well,
to meet
thanks
you,
for
Adrian.
being here. Really intrigued and excited about this chat and your mission. Before that, maybe talk about Belong.Life, how it started, how it became such an intriguing community, and what's the big idea for patient care.
Okay, we opened Belong.Life about 9 years ago. Me and two co-founders lost family member to cancer. I lost my uncle, my grandfather, and at that time, my brother, my sister, my mother brother was sick. The CTO lost his mom at that time, and later his father is diagnosed with metastatic pancreatic cancer. So we wanted to have the patient have the right education in the right time and to have the right support. In our families, we felt that we brought them to the best physician, but it was actually the most famous one. We thought that if we take them to the oncology, it's his job to make them cure, and cancer is a project. You need to be a part of your success. So we build a patient and professional communities, so patient could engage with other patient that was already in the same path like them. They can share their interest and connect them with worldwide expert, a professional physician from the far Vermont Center, etc., to support them on their journey. While doing that, of course, using nicknames, they know private information, they learn from other patient challenges, and we gather a huge amount of data and challenges that patient actually facing that will enable us to later build Dave. Dave is our AI cancer mentor that just become medically validated in ASCO and ESMO publication this year. And now we can support hundreds of thousands or millions of patients worldwide in several seconds a day per question.
Amazing. Well, what a wonderful mission. And talk about the massive communities you built. I think cancer care and MS patients are among two of your focus areas, and
Yes.
how the communities are different from other social media communities like Facebook groups or Reddit communities or other places that patients go, which can be a bit of the Wild West these days.
Perfect. Yes, it's a great question. So we have cancer, and of course, the Belong Beating Cancer Together. It's an app that including patients and a professional answering each other in a micro community. So when you enter to this world, you're using a nickname. Nobody really knows who you are,
Mm.
and everyone is a patient due to the profile. Of course, we're using moderation to make sure that it will be very supportive to patient and nice, and the education would be something that you can trust. It's a closed environment. Usually cancer patient, and we saw that in our families, they don't want the world to know that they are a cancer patient. Because they look at them a little bit different. They look at them as like sometimes as an infection disease or something that
Mm.
you still want to be aside. And they have real challenges that they really, really want to share with people that already had it or have it now. So this knowledge is very important. So it's a closed environment for Beating Cancer Together is for cancer patient. Belong MS is for multiple sclerosis patients. We have almost 200,000 MS patients in the US and more than
Wow.
500,000 cancer patients in the US using it. It's a multi-language app, so you can use it in French, in Spanish, and every other language too. In the last 2 years, we did the same with an AI app. So Dave AI Cancer Mentor, it's an app with generative AI, Dave, that you can see him behind me, supporting patients 24/7. They can upload the document. He will explain the documents. He can remind them about the next MRI visit. He can support them across all the journey all the time, and as it's private as it can be. Of course, you can still use a nickname and delete the sensitive information from the pages of the information you share. The same is in MS. We have other apps in other countries, not US, in Europe for IBD, Crohn, colitis, psoriasis, and now we are releasing the new app for obesity called WeightMate. Diabetes and obesity is the new solution that actually you cannot support so much people in the world without a generative AI and AI solution as its market growing.
Amazing. So how does the AI, Gen AI capability work in practice from the user's perspective?
Okay, so the one thing that's very important when we build Dave, the first layer was building the ARCH methodology. It's a trademark that we're using for accurate, responsibility, compliance, and hallucination-free. It's a huge methodology with reinforcement learning to make sure that we are actually answering something that is validated. We used about 80 million discussions between patient and physician and patient in our apps before. And we use the LLM engines, the large language model engines, to train the information and data on that. One of our unique solutions is that we're using several LLM engines to collect different information, make an answer, and then using a multiplexer to get the right answer out, making sure there is no hallucination. Yeah, it's making the answer to patient more expensive because you're using several LLMs, including open source too. But the answer is something that you can trust. And even in the research in ASCO, only 1% was not helpful. 1% of the answers was not helpful, but there was no hallucination to the patient. There was no invention that the generative AI do. On top of the ARCH methodology, we build a proactive environment. So knowing what the cancer patient actually have in their journey, some challenges, after chemo, you have side effect, and after the side effect, sometimes you need to go to an ER, or sometimes you're just going to an ER, although you didn't need to. You need a creatinine check for MRI, and there is a lot of things that we already know from the process. So we trained a Dave Pro. Dave Pro stands for proactive premium, to build this journey and support the patient across the challenges that he will have, not only the fact that what we know about him. That's really helping patients to always feel that they are in front of the challenges and can cope with them much better. I must say that Eliran, the CTO, in the last 2 years, used Dave for his father with a pancreatic cancer. So he beat the statistic with 2 years, much more than the statistics. And many of these months, not all of them, was due to Dave's ideas about stuff. And one of them was that he had a meeting with oncology 3 months later, and Dave told him, okay, according to the blood test, you need to tell them now. Okay, something has changed, you need to alert. They called the hospital, they told them everything is okay. Wait till your turn. He came to the hospital and they changed treatment.
Wow.
And in another case, they had he had a lot of water in the stomach, and he needed something to take the water out, and there was a huge mess everywhere. And they've support Irad in this case with a solution that he took from Crohn's colitis package to actually support you instead of having a water leak from your belly to the cancer treatment. Apparently, it was a case that some other physician already gave in our app in the past.
Wow.
Yeah. So that's something. We're using 2 billion data points that we already collected in the last 8 years in our apps to make Dave better and better. And we're using not only reinforcement learning, but the team over here to make sure that when everything sometimes is looking a little bit different, we can make it a little bit better.
Impressive. I love the focus on personalization and making sure every patient feels seen and heard. I mean, that is so impressive. Let's talk about your business model, as it were. You partner with healthcare organizations as well. How does that partnership look like, and what sort of partners are you looking for?
Okay, so we have patients are our customers. Not always they pay. In most of our apps, they are not paying, but they are our customers. This is why we build this company. Second layer is providers and payers and pharma. So pharma, mostly advertising. It's very clear. You can see that everywhere in every app in the US, in every solution. Advertising and sometimes some de-identified research or find patient to a clinical trial. When the patient in our apps, we already support 30,000 patients to find a clinical trial. So we got information from NIH, etc., and match the patients to a clinical trial. So research and advertising, that's what we usually do. Of course, de-identified, anonymized, nothing is personal, just understand what the challenges of adherence in the market. Providers and payers, the majority are going now with a smart clinic solution. So we have, it's relatively new, just in the H2 was released. We have a solution that helping patients to onboarding to a clinic and hospitals with generative AI, very easy and fast. Basically, patients get a link to a website. They log into the website of the clinic or the hospital. There is a discussion with the generative AI. All the documents are scanned, going through OCR and NLP, and the physician in the clinic get a Word document with all the data already built in. So he actually saving all, checking the insurance, checking the documents, reading all the documents, checking the differences, and then put it in the documents. Everything is already done by the generative AI. Of course, with the original documents attached as appendix to the document itself to make sure that he can check the accuracy of every process. That saves about between 30 and 50% of the nurse, of course, a new patient coordinator or a physician in different cases. So that's something that's going very fast. And now we have several discussions with payers to actually almost prescribe Dave AI as an app for cancer patients. The fact that they can get support 24/7, a full year, with it's several dozens of dollars a year. It's giving the patient a new lifeline, can actually save them. They're going less to the ER, less treatment changes, feel better and beating the statistics. That's why we build Belong.
Wow, wonderful. Wonderful mic drop moment there. So you'll get lots of questions about privacy and data protection, I guess, especially with a lot of the emerging regulations in Europe and elsewhere. How do you keep patient data secure on Belong.Life?
Okay, so we're working with the most extensive security and privacy policy. Of course, it's very clear. Users usually engage with our platform with a nickname, so we don't know the real name. We don't need to know the real name. No ID, no any other PHI information. They share only what they want. And we're using a de-identified engine in our service. We support HIPAA compliance, GDPR, ISO X and ISO Y. I don't remember all the numbers, but we are on there. All the information that we're actually using to understand the challenges patients have, going through the identification and summarize aggregated data. So it's always the minimum sum is usually between 30 and 100. So we can know that 30 patients have the same challenge, but you cannot go to number one. No one in that case. We're working with government institute now with the Ministry of Health, even in Israel, and now processing with other countries in Africa, in Australia, and several others universities. It's very, very important for us and for others. Make sure we are going for everything as the best. And as you can see in the sign of outside my room, patient is number one. We are.
Wonderful.
We are patient. I'm using David for my mom now, so hopefully everything will be okay, but still.
Yes. Well, it's great. No, I can't wait to suggest it to friends and family as well. So looking at the big picture of cancer care, let's say, a lot happening. What are some of the big macro trends you're tracking or adapting to, on the care side? What are the things you're personally following or excited by, or worried about when it comes to trends?
I feel for generative AI, and of course, Dev is changing the world as we see it today. So for today, let's say a year ago, if a patient was contacting me as a cancer patient, I was trying to help him with my team or for our communities. Today, I will tell him, download Dave. It's an app. Use it. 24/7, every question, the stupidest question that you have in mind, ask. He never get insulted. He never tired to answer the question. He can always elaborate more. and is your tool to win. And it's not. I don't have any research to say that it's a life-saving yet. But if you will go to our website, to the app stores, etc., you will see dozens or thousands of cases patients said it's a life-saving for them. At least the quality of life in the journey is life-saving, and for the result, we believe that we will have this solution too. I think every patient in the future will have some kind of an health mentor to support them 24/7 all the time. I can see my kids even today, they feel less comfortable to speak with others, but feel easier to speak with a computer or with something else. You can ask and you can have support from Dave all the time. And with the ability now with the research and publication in ASCO and ESMO, the most important conferences in oncology, we are now getting to hospitals and clinics. So in far places, like in Africa and Australia and other, that you don't have an expert in oncology for prostate cancer and for breast cancer or metastatic breast cancer. You have one that needs to know everything. They need a tool like Dave that research the internet, learn from hundreds of physicians, hundreds of thousands of patients, medically validated all the time and always up to date. Something that you can support patients much better. And of course, they can get it. So I think it's changing the world. And we eat our own dog food in many cases, in we call it. So we're using it for our families over here. So we make it much perfect. We change the shift. The patient in our Beating Cancer Together app, when we had physician and patient, the majority of the question went very fast to Dave. Patients start getting answers very fast, very long answers, very collected. So we're shifting our business over there, and I'm sure payers, providers, huge organization will have a solution like that to support their people. It's much better, much faster, and significantly cheaper.
And anything beats Dr. Google. You can't believe how many rat races, rat holes you go down searching symptoms on Google, and hopefully we'll get beyond that era as well. But what's next for Beyond a Belong.Life? Any features or functionality or other tools that you are envisioning? Anything you can share for the next year or two?
So in the next year, we are focusing on increasing Dave, penetration to the market, especially hospitals and payers. We have the obesity app. Fred is a new Dave, AI health mentor for obesity and diabetes. This is the most fast-growing market in the world, not only in the US, and a huge challenge for people. And the smart clinic solution. This is something that if you speak today with a health organization, they will tell you that one of the biggest challenges they have is that the demand to meet physicians and nurses is going up, and the number of hours of free time that they have is going significantly down. Once we can take all the paperwork away and just lowering that, we give the nurses and the physician the time to actually focus on the patient, actually see them instead of keyboarding their information in. And that's the three things that will change a lot in our aspect. Of course, in that process, we will be everywhere.
Wonderful. Well, we can't wait to help get the word out. Do you have any upcoming meetings or events coming up? I know here in the US you have CES, which has a big digital health component, and of course HIMSS and other events. But what are you looking forward to, travel-wise, event-wise, meetings, other get-togethers? Anything on your radar?
Yes. We have several of them, and I'm sure you already know. Just last week we were announced as the top innovation of Times Magazine. So that's an amazing win for us, and being on the special mention list of them. Thank you very much. It's very important. And then we had we acknowledge that one of the 8 top solutions in oncology worldwide by Startup magazine. And HLTH put us on the quarter list of the best solution oncologists. So So that's just in the last 2 weeks. It's very amazing. We have several in the next month or so, including in all the spaces, but I will not share it publicly before it's happening.
Okay, well, we'll be watching and listening. And thanks so much for sharing just an overview of the vision, the tremendous work, onwards and upwards. Thanks for what you do.
Thank you. Thank you very much.
And thanks everyone for listening, watching, reach out, check out the website, of course, and thanks for sharing.